Good evening, Dr. Karthikesan, and thank you for joining us. I'm Tiyash reporting from the World News from Kolkata.
So, we're here to talk about a major milestone, Tamil Nadu's first leadless dual-chamber pacemaker implantation. How this innovation is shaping the future of cardiac care, I would like to know. And also, you have been at the forefront of electrophysiology, as far as I know. From building Apollo Chennai's arrhythmia program to global fellowship that refined your expertise. For the next, I would like to hear your thoughts on the new technology, patient outcome, and what it means for healthcare access in our region. So, sir, coming straight to the question, you have recently performed the leadless dual-chamber pacemaker implantation. In plain terms, for layman, what did you and your team do? And what makes this device different from the traditional devices?
Yeah. So the patient usually, those who have the low heartbeat, our natural electrical system is not working properly. Own heart rate goes down. When they started getting, giddiness, bar behosh ho jata hai, loss of consciousness, breathing difficulty, fatigue, all those things, they get symptoms. Those patients only after evaluation like ECG, Holter monitor, or general pacemaker implantation. Okay. So till now, last maybe for 3 or 4 decades, we have 4 or 5 decades, we have been doing traditional pacemaker, which involves a minor surgical procedure. Usually in the left shoulder or the region below the collarbone, we make a 2-inch incision and then pass through a couple of wires inside the heart and fix it to the battery, which is there inside the, and then we'll stitch it with the sutures. Okay, this is a surgical procedure. Patient has to stay in the hospital for a couple of days, and their activities are restricted for a few weeks or few months because it is a wound has to heal and they cannot take bath immediately. They can't do exercise. All those things are immediate limitation. They can't use their cell phone on the left side. These are the limitations. So the current leadless pacemaker is very miniature. It's only capsule size. It's like exactly capsule size. No cutting, no suturing. There is no collarbone. Is nothing involved. From the groin, we pass a small that go inside the heart and deliver the electrical system there, and the capsule will leave it inside the heart, and then that works for many years, 15 years or 20 years also. Okay. So in that advancement, that dual chamber. Okay. Now till now, the leadless pacemaker, we are putting only one chamber in the heart. Now that recently, and first in Apollo group, and first in Apollo Chennai, and first in Tamil Nadu, we have done the dual chamber. That means 2 capsules. One capsule in the lower chamber, one capsule in the upper chamber.
Okay.
So 2 capsules will fit. So the advantage is that 2 capsule almost equivalent to traditional pacemaker till now we were performing.
Okay.
So the till now traditional pacemaker, I told the limitations. It involves the surgical all those things. This doesn't involve any surgical procedure. It's a catheter-based procedure done under local anesthesia. Patient can be discharged on the same day or very next day, and very soon he can get back to his routine activities.
Recovery is very fast.
Very fast. He can do the sports activities. If you want to play golf, if you want to swim, if you want to play badminton, everything he can do it. There is no limitation. And there is no question of wound healing or suture removal. There is no question of wound infection, and wound swelling, pain. Nothing is there. Okay.
Sir, how long did the procedure take to finish?
Procedure takes less than 1 hour, 45 minutes. That's all. 45 minutes, done under local anesthesia, and from the groin itself will do it, and then few hours patient has to take rest, then he'll get back to normal activities. That's all.
Right. Fantastic. Sir, is there any age or like comorbidity limits that you consider to put this the new dual chamber pacemaker?
Yeah, very important question. Previous available leadless pacemakers, I told you we put it only one chamber. So it is considered to be very inferior. Now we have 2 capsules, upper and lower. It is equivalent to traditional pacemaker. Previously, when we were doing that one capsule pacemaker, okay, so that problem was that is you can't take it back. Once the battery is finished in 10-15 years, you can't take it back. We have to put a new capsule. So we don't consider that for young patients because you can't put multiple capsules inside the heart. The current new generation, the last or latest involved thing is, it can be removed also. Once after 10 years, 15 years, the battery is exhausted, you can remove the capsule, you can put the capsule inside.
Okay, so because of that, there is no need to have tension, like battery life expectation and complications and all. Yeah. Okay.
Yeah, you need not put multiple capsules. Once in 10 years, you need not put multiple capsules inside the heart. You can remove the old capsule, put a new capsule. Because of that, we can even consider for younger patients. Once you are not able to remove it in the previous generation, you can't put multiple capsules. The heart is a small cavity. You can't put multiple capsules inside the heart. Now, there is a space for the blood flow also. You can't put it many capsules inside the heart. So, we restricted that usage for only old people. Now, the current machine, where you can retrieve it, you can remove it, so we can consider for even for younger patients. Okay, even younger patients after 10 years, battery is exhausted, remove it, put a new capsule, like that we can do it. So there is no age for the current patient. Okay, and also it is more useful for the more comorbid patients. Yes. The patient is more sicker, patients, they can undergo operative procedure. Where this procedure, there is no operation is involved. So that even sick patients, multiple comorbid patients also, this can be used.
Right. We get the maximum result minimum by minimum hassle, right? Yeah.
Exactly.
So this is the future, I guess. So from a hospital operations and cost perspective, what changes are required to adopt these leadless pacing programs?
No, first is more important is creating awareness.
Right.
The public now should be aware that there are two models of it. Till now, they are left with no option. They are left with only one option, that is traditional pacemaker. Now they are left with the two options. Whether you want to go for conventional pacemaker with the cutting, suturing, surgical procedure, or you don't want it, you can go for a leadless pacemaker. So that awareness will be created in the public. And then those who can, the only difference is cost will be higher side. The leadless pacemakers are newer technology, this will be higher side. So the cost is not a problem, they can go for a leadless pacemaker. That is the important thing.
And sir, what about also the training, equipment and the supply chain hurdles, they are working well?
Yeah, so that needs special training. Now, as of now, not everyone can implant this leadless pacemaker. Only trained physician, electrophysiologists like us, we are trained as these procedures, and we do carefully selected patients. Very carefully we'll do it because it's a newer technology advancement. You have to go very carefully inside the heart and place it so that it works beautifully for many years. So that is important. It needs advanced training, which we have undertaken all those trainings, and we have started implanting successfully for many cases now.
Right, sir. Sir, it's like you were the leader in ablation and in the device therapy. How does the rise of technologies like these leadless pacemakers and also others, they change the overall strategy of heart treatment? The treatment is going more fast and forward, and it's like other world, right?
Exactly. Because those days, the 20-30 years back, once someone suffers a rhythm disorder, whether it's a fast heartbeat or slow heartbeat or all those things, been managed only medically. There is no technological advancement, there is no interventional treatment available for those patients. Now, last 15-20 years, especially last 10-15 years, lot of technological advancements in this field, that is rhythm disorder. Heart rhythm disorder. We are specialists in managing heart rhythm disorders. Okay, we're electrophysiologists. We deal this problem. Those who have very fast heartbeat, erratic heartbeats, we go inside the heart, find out the source of erratic heartbeating, excessive heartbeating. We can neutralize it with the cryoballoon ablation or radiofrequency ablation. We neutralize the heartbeat, will maintain the normal rate.
Right.
Those who have the low heartbeat, we do that pacemaker implantation. An advanced pacemaker like conduction system pacemaker implantation, leadless pacemaker implantation, like heart failure device implantation. So a lot of electronic gadgets are available to stabilize their rhythm, to boost their pumping function of the heart, to safeguard them from sudden cardiac arrest. So all those things are technological advancements. It's very developed in the last 10-15 years, and public awareness is also slowly we are creating, and more patients are aware about this heart rhythm disorder. There is an exclusive specialist are available to deal this problem, and they approach us. We can sort out that problem, and then we can recommend them what is the appropriate treatment, either the medicine or the interventional treatment, or they go for pacemaker, either they go for radiofrequency ablation, or they go for cryoablation. So all we can sort it out.
Right. Sir, जितना भी नया टेक्नोलॉजी गैजेट जितना भी आए, we need to prepare our next generation also, right? So the question is, how are you preparing the next generation of physicians in India for these novel technologies? How early career cardiologists who are in their studies and all, how do they focus in this type of specialized skills?
No, they have to know the cardiology is the general cardiology training. During they will not get adequate exposure to deal this problem during their training in the cardiology. After finishing their course, the cardiology course, they have to take exclusive training to manage the rhythm disorder, or some people channelize into structural interventions, some people channelize into coronary interventions. Cardiology field is very vast now. Those are the days of gone. One cardiologist managing everything. It's not possible now because they have to specialize. Whether you want to manage a heart attack patient, whether you want to manage a valve patient, you want to manage a rhythm patient. So they have to another 2 years. They have to take special training in a specialized center, high volume center. They have to take special training to adequately get trained themselves to do all those procedures and manage these patients.
Yeah, yes, sir. So just one last question. If you could tell patients one clear sentence about why this advance matters, what would you say? Why these advanced technologies matter so much? Why do all need to take and appreciate the technologies? Why would you say?
One thing, their quality of life gets better. Their quality of life, if their suffering comes down, their quality of life gets better. Even for example, the leadless pacemaker, patient can get discharged very next day. They can do all the activities. They can handle all the electronic equipments. There is no limitation. There is no suffering. There is no loss of consciousness. Their quality of life is better. So the more and more advanced technology is making them more happier, more improve their quality of life, lesser hospitalization, lesser sufferings, and lesser medications. That's very important. Lesser medications so that they can enjoy their normal life. That's the technology developments does for the patient.
Right, sir. Sir, thank you so much, doctor, for your time and your insights. It's inspiring to see such innovation in cardiac care emerging from Tamil Nadu. Also, we appreciate your work and your commitment for advancing heart rhythm therapy for patients across India, sir. Thank you so much, sir. Thank you.